Hey everyone, my name is Dr. Cassidy from Chiro for Moms and Chiro for Kids and Chiro for Chiros. If you found this video, you are likely a chiropractor and you have found your community. We have built a space meant for chiropractors and centered around niche care and cash practice tips. If that is something that would be useful to you, make sure you go check out our YouTube channel and subscribe. If you are interested in the prenatal and pediatric realm, you're also going to want to subscribe because that's our niche. That's what we do day in and day out. But today, I am specifically covering the importance of incorporating soft tissue work as a chiropractor. What am I referring to when I say soft tissue work? The things I am referring to are our soft tissue mobilization techniques. They are our neurlymphatic massage techniques. It could be ischemic compression, as in working on trigger points. It could be instrument-assisted soft tissue mobilization. Graston is a really common one. Cupping, dry needling, vibration therapy, those are all forms of soft tissue work. And chiropractic adjustments and these soft tissue techniques go together like peanut butter and jelly. They are beautifully paired. When you incorporate both with your care in your clinic, specifically you in your clinic, you are going to get better outcomes, which is ultimately what your patients are going to pay cash for. Soft tissue work isn't a waste of your time, but it does take more work, more effort, and more time. But let's review all the great things that a soft tissue technique can provide when we're talking healing and pain management for your patients. First and foremost, all of these sorts of soft tissue techniques are going to improve blood flow. Blood, lymph, nerve, they all flow together. Improving blood flow increases the nutrients, increases the oxygen to the area. These soft tissue techniques can help proliferate, recruit fibroblasts. They can help increase your collagen synthesis. They increase vascularity, aka blood flow, and they increase perfusion. So they increase blood flow to the right areas. And if you are working with soft tissue techniques already, these are things you can tell your patients. And they are simple, easy to rattle off. You know, you can leave out the science jargon, leave out the fibroblasts and the collagen, but say, hey, we are increasing your blood flow, which is going to promote healing. You are going to feel better faster. It's going to take care of your inflammation, or we are going to address your inflammation. And those are things that your patients are going to understand. So they're also going to see the worth in the soft tissue technique that you've chosen. Overall, let's talk about the pros of incorporating soft tissue work into your chiropractic care. Number one, soft tissue, mobilization techniques. A lot of times there is minimal or no financial cost for you as a business owner. You can use your hands. Hands are the biggest tool you have, or you can buy simple instruments and tools. Low cost. That's pro number one. Pro number two is the outcomes that your patients will get. Those are big rewards. They will benefit from this added care. And that leads me to number three. The third pro of adding this into your typical care is it feels good for your patients. And patient experience is everything, especially if you are a cash practice. If this is the first time on our channel, you need to go check out those videos. We have extensive videos on why patient experience matters for cash practices, how you can influence that. This is one of those ways. Incorporating soft tissue work improves that patient experience because it feels good generally, and the outcomes are better, which leads them to a better experience. whenever we look at pros, we also have to look at the cons. The biggest con of adding a soft tissue technique into your care is that it's going to take some of your time. And there is something to be said about you, the chiropractor, doing this work rather than having an assistant do this work for many reasons, as you can assume and think of in your head, your expertise, your knowledge on what they're doing, what they're feeling. You are in charge of their care. It makes more sense for you to be in charge of whatever therapy that includes, in my opinion. But it takes your time. These things, of course, lead to great outcomes, but it can decrease the efficiency of your clinic. If you are a high volume clinic that is insurance based, adding more techniques that are going to take up time might not be the route for you. But if this sounds like something that you want to incorporate into your routine care, then specialty cash practice might be the route for you. And again, I'm going to encourage you to go check out our other videos, get inspired about ideas, how to make things work, how to be successful, how to market, how to network, you name it. We probably have a video on it. And if we don't, leave us a comment, leave us a DM, find us on Instagram, and we will answer it for you. We will let you know what we think. That is all I have for you today. I hope you enjoyed this video. I hope it was helpful. And we will catch you next time for more business tips.